Hello, this is Milton. Today I'm going to talk about anxiety from an MRI perspective. And first, I'm going to talk about the problem. Second, I'm going to talk about the interactional view and what that means in terms of anxiety. So first of all, what is MRI? MRI is a family therapy approach that started in Palo Alto, California, and it's called Mental Research Institute. So it's one of the founding groups of doctors that started the whole family therapy movement. And so in this movement, it focuses on problems. So let me give you some of the tenets of a problem according to the MRI approach. A problem is characterized by persistent failed attempts to change some distress. Problems are created and maintained through the mishandling of difficulties. Not all the life difficulties are considered to be problems. Problems are defined as those difficulties that cannot be resolved. For example, a child breaking curfew is only defined as a problem to the extent that the parents are able to manage the behavior. After repeated attempts to punish the child, the most families would then define the situation as a problem. In the MRI approach, the therapist focuses only on the identified problem and does not search for underlying pathology. So what does that mean? So a problem is only a problem in so much that the family or the person considers it a problem. So I might be anxious, or I might have had anxiety thinking about my life growing up. But it wasn't a problem for me, or at least I didn't recognize it as a problem. And so because I could still go on and live my life and complete all of my schoolwork and chores and things like that, it didn't become a problem. But I'm sure if it did become a problem where I was not able to function at school because of my anxiety, because I believe I do have anxiety because I take some prescription psychotropic medication right now for anxiety, or else I probably wouldn't even be able to talk to you on this video right now. So let's talk about problems. Whenever we're beginning therapy from an MRI perspective, we would utilize and explore the problem and the attempted solutions. First question I would ask would, what is the problem that brings you here today? And then I would ask all the people in the therapy room, if it's a couple, if it's the child or the patient, client, I would ask him, what's the problem that brings you in today? He would say anxiety. So I would say, how is it a problem for you? And then if there were other people, I would say, Mom, how is it a problem for you? Dad, how is it a problem for you? Aunt, how is it a problem for you? So identifying the problem is very important in this therapy approach. And after I asked that, I would ask, what does it stop you from doing or make you do that you do not want to do? So first I identify the problem. What brings you here today? What's the problem? I don't go so much into the past. I want to focus on the here and now, because I believe that there's nothing we can change in the past, but we focus on what's happening now and looking forward. So what is the problem? How is it a problem? And what does it stop you from doing or make you do that you do not want to do? So that's one of the very first steps in this brief therapy approach. And usually in this kind of therapy, it's about 10 to 12 sessions. And usually your problems should be solved or at least headed in the right direction. Because in systems or MRI perspective, it's not about speed, it's about direction. As long as you're headed in the right direction, that's the important thing. So in terms of anxiety, you want to see how it's a problem, and what does it stop you from doing? What does your anxiety stop you from doing on a normal basis? So regardless of where the anxiety comes, the kinds of problems people bring treatment persist only if they are maintained by ongoing behaviors of the client and others with whom the client interacts. If such problem-maintaining behavior can be altered, the problem will be resolved or will vanish. Therefore, the therapist focuses on current behavioral patterns and sequences. So, MRI focuses a lot on interactions, like what is maintaining this problem, and how is it a problem for, or when does it happen? When was the most recent time that you had this anxiety attack, or when you felt anxious, or when it came upon you? Tell me what was the context, what was happening at that time, with whom was it happening with? So those are the first two concepts that I wanted to talk to you about today. It's very important that we all kind of look at our anxiety and look at it from a problem. Who is it a problem for? Is it for just you, or is it for the whole family? And then it's good to look at it from an interactional view. Like when you're having anxiety, or when you're feeling anxious, who is there? What are they saying? So that we can see how this anxiety continues to persist and continues to become a pattern in your life. If you like this video, please subscribe. Thank you very much.